approaching, and that means getting out that bathing suit and perhaps that small black dress that makes everybody go, wow. But during the particularly long winter we just had, and after all those delicious holiday meals, the extra pounds have mounted and may have become a little too hard to get rid of at the gym. So it's plastic surgery the answer to help us achieve a better look or get a better look. There are highly qualified professionals capable of making miracles in the operating room. Unfortunately, some patients try to save money by having these procedures done by unlicensed individuals. And here to help us understand the situation, get a better idea of what plastic surgery is all about, we have a plastic surgeon with us, Dr. Jeffrey Jagger. It's a pleasure having you on the program, Doctor.
Thank you for having me.
Thank you for being here. We hear, let's start with all this stuff that we hear about in the news. We hear all these horror stories, Doctor, about people who are trying to save a little money. I just mentioned it in my introduction, who cut corners and end up trying to get a plastic, some kind of procedure done in a private home even. We see this over and over again. What do you say to that? How should people get better information about what care they really need?
Well, it always amazes me. You know, I've been a private plastic surgeon in Washington Heights for 14 years. Before that, I was a Columbia Presbyterian for many years as well. And in the community, you hear terrible stories about...
We see the pictures on television. It's horrifying.
And it makes for great TV, unfortunately.
Yes.
And patients will do anything to look better, especially in the Hispanic community where beauty is at such a premium.
We're going to talk about that.
Oh, absolutely.
Okay.
What people are willing to do doesn't seem to make sense when you say it like you had been saying it in the introduction. You know, would somebody really have medical services done in an apartment or in the back room of a salon or a spa? But they do, and what happens is their girlfriend says, oh, I went here, it was great, and it was $800, it was $1,000, and they injected something, and now I look great. Come with me to this person. And for some people it might work out okay, but you know, it's illegal, number one, and there's a reason why we have medical licenses. There's a reason why things need to be done sterilely in a respectable and professional environment. And unfortunately, people's willingness to bend those rules to get what they want overcomes common sense sometimes.
Are there licensed plastic surgeons, and is there something else that they can pass themselves as being some kind of license?
Well, I mean, you have to be very, very careful. And nowadays, everyone wants to do plastic surgery. And it's not just unlicensed people who say they're doctors in other countries or nurses, bringing things in from other areas and parts of the world. A lot of doctors are very, very deceptive in their advertising as well. And what I mean by that is people will advertise, you know, people know now, you know, you want a board-certified plastic surgeon. But people will use confusing terms. People will say, board-certified cosmetic surgeon, and
that's not the same thing.
No, no. There's an organization of cosmetic surgeons that's not a board the same way the American Board of Plastic Surgery is, and they'll let anybody join. You can be a dermatologist, a family practitioner, an OBGYN, and their criteria are that you have to do a certain number of cases a year. It has nothing to do with your training. So you can go and you see a sign, oh yeah, he's board-certified. I saw it says board-certified cosmetic surgeon. Well, not a plastic surgeon. Or they are a...
wow, so it's not just a fly-by-night guy who is pretending to be a doctor. There are other people who have a certain amount of training, but not enough.
Well, it's some of the most popular doctors around doing cosmetic procedures really had no residency training in that field. A lot of the fancy medi-spas where doctors are supervising, you know, I see every day psychiatrists, anesthesiologists, people with no real training in aesthetics and cosmetics are opening these as money-making ventures and hiring people to do whatever laser or small treatment that they can. And the problem is it's not illegal, but it's deceptive. And you'll hear terms like facial plastic surgeon. Facial plastic surgeon is an ENT trained person. It doesn't mean they can't do cosmetic surgery, and you know, to do a nose or a face or eyelids, sure, that's part of the face, but they're doing liposuction, they're doing breast surgery, they're doing tummy tucks.
And they're not trained for that?
Usually not in the regular training, and to just go and watch somebody do it is not always sufficient training. And it's not that I think that they shouldn't be able to do it, but I do think there should be truth in advertising, and you should know what your doctor is trained in before deciding to have surgery there.
When you see yourself, you're watching television, you see one of these reports, so-and-so police just arrested somebody,
Yes.
and you see the pictures of the work that they did, and some of them are horrendous.
Yeah.
What do you say to yourself? That should have never happened?
Well,
Is it possible, I guess my question is it possible for it to be a genuine mistake?
It certainly is, and it would be disingenuous to say that mistakes don't happen, or even if you're a great doctor, you can get a poor outcome, and it doesn't always depend on what you do. Some patients are not compliant and don't follow instructions, and bad things can happen. Some patients don't heal well or scar well, and no matter who the surgeon is, they're not going to get a nice-looking result from a surgery. But the thing that bothers me is when it's done by somebody who's not licensed or unprofessional, because the reason I opened Yager Aesthetics in Washington Heights was as a trainee in plastic surgery at Columbia. I saw every week at the recovery room and in the emergency room people coming in from the airport, from surgeries done overseas with infections, problems. And my thought was, as the only Spanish-speaking plastic surgeon at Columbia at the time, if I opened an office that catered to Spanish-speaking patients, it would be a helpful thing. And over 14 years, that's the message we've been trying to set out, is safety, qualified personnel, qualified setting to do procedures in. And when I see that people are going to salons and spas, it makes me feel that I'm not doing a good enough job educating the public as I'd like.
You've raised several interesting points. A lot of people, I hear this all the time, a lot of people going to South America for plastic surgery. Sure. Are there good plastic surgeons in Latin America?
Absolutely.
And because we hear only about the horror stories.
Sure.
So when people come, I imagine in Washington Heights, you get the horror stories, people who just got off the plane with a problem.
Right. Well, if they've had great plastic surgery, they're not going to come to see me.
Right.
So I have a skewed view of what goes on. And there are fantastic surgeons in every country. I've met tremendous plastic surgeons from just about every country there is.
Okay.
And the problem is making sure that you've made the right decision. And a lot of people who go overseas for surgery do it to save money, and the doctors they're picking aren't the best surgeons in that country. And they're the ones that are cheap in their country as well, and they're not as well trained. And in the United States, it's a little easier to tell the qualifications of your surgeon. You can go to plasticsurgery.org and look and see if you're a board certified plastic surgeon, or the American Society of Plastic Surgeons, and check qualifications. Whereas the training requirements in other countries are kind of iffy, and some are great and some are terrible. And you don't know which is which. And if you spent the money on your ticket and you've gone there and taken the time off, and you feel a little uneasy, you're just kind of like, well, I might as well do it. I'm already over here. I've already wasted this money, and that's when the bad things happen.
And it could end up costing you more.
No, it can cost your life. And you hear very often patients dying overseas from surgery.
Wow.
And the tricky thing is that it's not always the surgeon's fault, but if your healthcare system isn't great there, and say you're in with the best plastic surgeon in Santo Domingo, and he's fantastic, he gets great results, and he has a private clinic and it's beautiful, and you go there and you have a weird reaction to the anesthetic. No fault of the doctors. You need specialized treatment to save your life. They might not be near a hospital. If you don't have money to pay the ambulance driver, they're not going to take you. They don't have 911 like they do here in New York. And you can die through no fault of the doctor themselves, or if you have a complication, you have to come back to work. Who's going to take care of you? You can't stay there forever, and those are the main issues. It's not always the quality of the plastic surgery.
Which are the procedures that are really riskier and they should never gamble on? There are some that are like totally, don't mess with this one?
Well, it's not really that. I think the keys are the patient's health. If you have problems with your health, if you're diabetic, if you're very overweight, if you're hypertensive, or if you've had strokes or blood clots or things like that, it's much, much riskier for you to have surgery anywhere. And those type of patients should never travel for surgery, because they can have complications with the simplest of procedures wherever they are. And you want to have that great healthcare system around you. And the thing you really want to watch out for is when you're overseas, that's their moment to make money on you. So they're going to want to pile on as many procedures as possible. And to be under anesthesia for longer periods of time is definitely riskier. So you really want to make sure you know what your health is. And if there's no doctor in the United States that wants to operate on you, there's a reason for it. Because doctors like to make money, but they don't like to do foolish things. And you shouldn't go overseas and lie about your health conditions. And if you are going to go overseas, you really have to understand the potential risks.
Okay, so you're in Washington Heights.
Yes.
You speak Spanish. I imagine a lot of your patients are Hispanic.
98%.
What are they looking for?
My patients, the most popular procedures right now are all body and breast contouring procedures. So breast implants and lifts and reductions. We do a lot of liposuction. I do more tummy tucks than any plastic surgeon I know. I've done over 1,000 already in Washington Heights. And
let me stop you. Is there a time when you say to a woman or a man, I imagine, you really don't need a tummy tuck?
Absolutely.
Okay, because I see people all the time who tell me, I got to see a plastic surgeon, right? And they have no tummy.
Yeah, it's...
Does that happen?
Sure. You want to really be careful that what the patient's perceived problem is a real problem. And there's a disorder called body dysmorphic disorder, where people have an unrealistic idea of what their body looks like, and they undergo multiple procedures for the most minute problems that really don't warrant surgery.
Some people are actually addicted to plastic surgery.
There are people that are addicted.
Who do it over and over and over again, or try to look like someone else. Does that happen to you, that they come and I want to look like somebody in Hollywood?
Well, I don't get a lot of that facially, but body-wise, everybody's talking about body shape, and in the Hispanic community, it's about curves and shapes.
Okay.
And one of the most popular procedures now
is
fat transfer to the hips and buttocks, because they like the round, full hips and buttocks. And people like, they like J-Lo, of course, right? We're in the Bronx, we should talk about her. And they like Thalia, they like Shakira, they like the curves, the small waist, the full hips and buttocks. Very, very popular.
So is the buttocks a new tendency, a new trend?
Yeah, definitely is.
Among Hispanic women?
Yes. It's because the techniques have gotten better. Liposuction has been around for more than 30 years. But fat transfers, using the fat of your own body to fill other areas, really started about 20 years ago, but only over the last 5 years has it gotten particularly popular. And in my practice, probably in this last year, I've done about 100 fat transfers to the buttocks to create those shapes, and the results are quite good.
So again, tell me a little bit more about the different ethnic groups. Is there something that is, you already told us a little bit about Hispanics, but what else? What other group has a particular tendency to like this, that, or the other?
Well, every ethnic group has its own little idiosyncrasies and quirks. And in the Asian populations, westernizing the eye, the double eyelid surgery, because there's an anatomical difference between the upper eyelids of Asians and Caucasians, where they don't have this deep fold that you or I have. And some women like to create that fold. In China, there is a link between prosperity and large earlobes, which is a very strange
How interesting,
quirk.
Yes.
So if you're prosperous, you have large earlobes, and people like you want to plump up your buttocks, they like to plump up their earlobes to look more prosperous. And in other communities, in the African American community, it's a very similar aesthetic to the Latin communities as well. Other ethnic groups really want to look more American, and there's a lot of tendency to do nasal surgery to remove kind of from Eastern European countries to get more of an American, a refined nose.
So do these people come with a determined idea of what it is that they need, or do they sit down with you and say, doctor, what do you think, and should I really do this, or are they determined, I need the tummy tuck, and I don't care what you say, doctor, I'm going to have a tummy tuck, it's either you're going to be you or someone else?
Right.
Does that happen?
It does happen. That's the kind of patient I don't like to see. For me, it's, I think of myself as a partner of the patient. So the patient and I are going to figure out, I start out by what bothers the patient. What bothers you about your face or your body? Why are you here? Why are you coming to see me? What is it? And if they say, oh, I don't know, I just want to look better, I
want to look younger.
Yeah.
Is that something you can correct? I mean, with facial?
There are certain things you
surgery?
can do to make somebody look better. But I really like the patient to be the one to lead me into the areas that are bothering them, because somebody can come in and I'm looking at them and I'm saying, I'm sure they're here about this horrible loose skin on their neck, and they're actually here, because they have a mole and they're not interested at all in their neck. And I don't want to say, oh, we can really fix your neck if they've never thought about it. People get hung up and preoccupied with their appearance so much. I never want to make somebody feel badly about a body part that they've never even thought about. So I let them always lead me and tell me what it is that bothers them. And I try to make them more specific. If they really have no idea, I tell them to think about it and come back. But it might be, a lot of times it's, I've had a baby and I gained 50 pounds and I have stretch marks, my body just looks horrible. And we say, well, let's start with your body. We'll give you a gown and change, and we'll look in the mirror and we'll go part by part. What do you think about this? What do you think about that? And we make a plan and we prioritize and we talk about the risks and benefits of each thing to try to come together on a decision. It's not my job to tell you exactly what you should do. It's my job to inform you of the options, what's safe and not safe, time off, risks and benefits, and then it's your decision, and that's the way it always should be.
Doctor, where do we find you? Where's your practice?
My practice is right by Columbia Presbyterian on the corner of 165th and Fort Washington Avenue, Yager Aesthetics.
What's the phone number and contact information?
You can call us at 212-543-1700. You can visit us on the web at www.dryager.com. That's dryager.com. You can follow us on Twitter. We're on Facebook. And I think a visit to the website will give you a really good sense of the center and what we've accomplished in Washington Heights.
We will do that. I may check it out myself.
All right.
My pleasure. Thank you for being on the program, sir.
Thanks.